Hello and welcome to BORNO Health Update. My name is Ibrahim Amarawa. Health Update, as you are aware, is a program designed to update you on Governor Zulum's transformation drive in the healthcare sector under the leadership of Professor Baba Malam Gana, the Commissioner of Health and Human Services at BORNO State. Governor Zulum prioritizes health of his people by investing huge resources to revamp and reposition the sector, which continues to draw the attention of international donor agencies. The Gates and Melinda Foundation was among many of the international donor agencies that came to Borno to support Zulum-led administration in its recovery and stabilization process. During the high-level roundtable discussion with the Gates and Melinda team, the Commissioner of Health and Human Services, Professor Baba Malam Gana, in a visual presentation enumerated the government's plan to upgrade the entire health system of the state.
And therefore, it's important we put our heads around this so that we can take, actions and change the community, change the behavior, change the attitude so that we can curb the death of our young girls and women. As you know, pregnancy is not a disease. It's a physiological phenomenon. And therefore, we shouldn't allow it to become a disease. And we are really grateful to His Excellency, the Executive Governor of Borno State. He has declared free maternal services in the state. And this includes all the drugs that are, needed during pregnancy, and also cesarean section. Patients or the people who need cesarean section don't have to pay for it. So at community level, we have to raise the awareness because it's very low, and there are cultural barriers, some of which is that the husband or the partner has to give consent for the wife or partner to go and attend to be attended to in hospitals, and therefore, even if they needed cesarean section, in some areas the husband has to give consent, otherwise it's not carried out. So we need to look at these cultural barriers because it's unacceptable that we're having such high maternal death in Borno State. We need to look at the issue of transportation, which a lot of women, the poverty rate in Borno State is over 65%, and therefore not everybody owns cars, and therefore if a woman goes into labor in the middle of the night, then she can only be assisted by her neighbors if they have vehicles. If not, then she has to struggle until the following morning while commercial vehicles are available before she could have attended to in our hospitals. So we want to change this. I will inform you later on about the plans we have for this, but certainly emergency transportation system is a must at the beginning for our pregnant women and newborns when they are not well. So our priorities in terms of maternal and newborn health facilities are: we want to improve access to emergency obstetric and newborn care. We want to strengthen antenatal, delivery and postnatal care services. We want to build on the capacity of health care providers in life-saving interventions, which we will talk about later on. We also want to focus on increased availability and access to high-quality maternal, neonatal and child health products. And we also, we have just started emergency transport and referral systems through the state emergency medical services and ambulance services. Next slide, please. So our vision in the Ministry of Health and all the agencies is to improve maternal and the newborn health outcomes. For example, reduction in maternal mortality, increase the use of skilled birth attendants. We want to strengthen health systems, including robust referral and emergency care networks, and we want to have a full community ownership in the context of having maternal newborn health programs and a greater health-seeking behavior, which in many places is lacking, and it has to be sustainable. Otherwise, we can do it today. If it's not fully owned, then after some years it will go down. So we have to make it the ownership of the community for their full participation and owning up to the programs.
That was the Commissioner of Health. Responding, some of the team members of the Gates and Melinda Foundation, while highlighting their presence and interventions in many countries across the globe, acknowledged the efforts of Governor Zulum's administration for prioritizing healthcare and promised to support the government in its effort towards improving the well-being of the people.
Thank you very much for your presentation, Honorable Commissioner. I was amazed at the level of detail that you know, and I imagine this is just one of hundreds of topics that you have to. So I was like, it was very impressive, the level of detail you went into. It was very helpful for our orientation because we're in a different place than the Gates team. We're here more to explore opportunities. We have done some work in Nigeria as Bloomberg Philanthropies, which I'll talk a little bit about in just a moment. So what I'm going to do is just give a little overview, very high-level overview of what is Bloomberg Philanthropies. And then Samantha and I really wanted to talk about a program we supported in Tanzania. We'll go back to Tanzania and just share our experience and some things that we learned. We feel like there were some lessons from Tanzania that are applicable to any place in the world, including high-income countries like the US, which also has a maternal mortality crisis.
Numbers, we are looking at the SDG targets for 2030. We have seen a really tremendous drop in maternal mortality rates of 36% between the years 2000 to 2015. But now it's stalled. We really see it stalling, and I think that's a clear call for action. Because if we remain doing things as we do it today, we will never accomplish our SDG targets. What we have seen is that although there's a lot of excess burden on the maternal and newborn health side, there's really little donor support going into that area. On the one hand, we really see a benefit in having domestic resources going into that, but we also understand that there's support that we can contribute to it. This is really the overview of the portfolio the Gates Foundation is also supporting, and that speaks pretty much to the MAMI initiative as well. So you see throughout the pregnancy, we see that the multiple micronutrient supplements are very key, also helping to reduce on the stillbirth sides and helping preterm babies in particular. AI-enabled ultrasound is very important. I mentioned it for the early risk stratification and referral into facility levels. IV iron, we know that anemia is one of the leading causes of postpartum hemorrhage. So if we also address not only moderate to mild anemia, but also severe anemia, already here we have the opportunity to reduce the risks of postpartum hemorrhage.
And Professor Hadiza Galadanchi, they are expanding the centers of excellence for postpartum hemorrhage treatment. BORNO is one of them, so we are really hoping that you can work with her to ensure that the new teaching hospital becomes a center of excellence for PPH management, and other health professionals can come here for training. The HSDF consortium is also working to ensure that we roll out the emotive bundle. We have the London School of Tropical Medicine who are helping us gather the intelligence, the data that will support us with decision making on where to course correct, whether we are making improvements or not. We also have NOI Pools that is also supporting the data collection. TA Connect is supporting the training and the rollout of the different innovations. And then the Economical Pharmaceutical Network and then the Christian Health Association of Nigeria are also helping us with the faith-based sector. You mentioned 50% of facilities falling within the private sector. Honorable Commissioner, that's big. I don't know what you are doing with the private sector, but I think that that is a sector that we really need to start engaging in and start having conversations around.
In another development, the recently inaugurated Borno State Emergency Medical Treatment and Ambulance Service Committee, BOSEMSAS, has commenced its activities with a learning tour to Yobe State, which is said to be one of the best so far in the country in emergency services. The committee was received by the management of the Yobe State Emergency Medical Ambulance Service, Yamabos, in Damaturu, the capital of Yobe State. BOSEMSA's chairman, Dr. Ibrahim Kida, explained to the management of the Yamabos the purpose of their visit, while Director Operation Yobe Emergency Medical Ambulance Service Agency, Dr. Saidu Garba, made a visual presentation of the agency's operational guidelines to acquaint the committee on the journey of Yamabos since its inception up to its development to agency.
Through the commissioner, inaugurated this particular emergency medical treatment committee, and sometimes in December 2024. We were inaugurated including or under the supervision of the NEM, that's National Emergency Medicine. Obviously, Dr. Dobra, Imran Dobra was one who led the team together with some of their other national officers. So, during the particular, after the inauguration, we were to start our activity. First of all, we started by assessing all the important key stakeholders. That's the Nigerian 7th Division Medical Services, the Federal University of Psychiatry, the University Medical Teaching Officer, the Police Hospital, and the State Specialist Hospital. Obviously, we visited those places to assess the type of ambulances because we wanted to know which areas have the standard ambulances that will be required for this particular project. And after that, well, during the commissioning or during the inauguration, Dr. Dobra made a lot of effort by stressing that in the country, Yobe State government, Yobe, particularly Yobe State, Enugu, I think, and Lagos, they have established this particular thing and it's going on very well. And then he suggested, well, since we are like infants now, then we should come and see where this is already established. So the one, we can also try and see whether we can fast track the way that we can establish our own. Because now we are just at the infancy. The committee, we really even don't know some of the differences between the committee and whatever the project itself, right? Because you have the committee, technical aspect of it, and then the committee that's supposed to do day-to-day activities of this organization. Now, also, by coming here, we also see the type of establishment which is made. We are looking for, we don't even have an office now. We are looking for, we thought it's going to be a small thing. And when we came here, we were actually quite surprised that it's a very big project with all the directors. Initially, we were thinking we just talked of finance unit, audit unit, and so on. We didn't know that it's quite an established project with all the requirements that's involved. So we felt that let us first come. Now, as we are coming, we are seeing things. But when we hear it from their mouth, how it's established, what are the functions of the committee, what are the functions, and then we will also now learn, we will record everything, and then when we go back, we'll also need to show our honorable commissioner. Initially, he was to come, but unfortunately, because of the duty of his office, because initially we were to come together, then finally he said, no, I think we should just come on his behalf. And when we go back, we will report to him all the things we've seen. We also have a video, so we'll definitely go and show the video of what we've learned. So, and for my colleagues from BORNO, I would say you are welcome. I knew Muhammad Jamil over some time, and we've been communicating. And on behalf of us all, we say you are welcome.
Also provided funding for the emergency medical treatment, which is supposed to be the 5% of the basic health care provision fund. Now, in 2016, the policy for the emergency medical services in Nigeria was established. And this is actually, its main objective is to ensure that those in need of urgent medical care are treated. And also, from that point of care, point of incident to the point of definitive care. And the overall thing is about integrating the pre-hospital and the hospital services, which before now, they are separate entities. Care of a patient starts from the hospital. Once the patient comes to the facility, that's where the care starts from. Now, Yobe picked interest and inaugurated its SEMTI, which is the State Emergency Medical Treatment Committee. For the emergency care assistance, for the recruitments, at that time, because we needed to recruit a lot of people, so there was a special consideration that, okay, we should ensure that this is a new recruitment, should be from the state, at least 5 from each of the 17 local governments in the state, so that every area in the state is represented in the emergency care assistance recruitment. And also, the minimum qualification should be community health extension workers. Now, by standard, depending on the type of ambulance, if you have a basic life support ambulance, should have at least 2 paramedics, 1 paramedic and a nurse, or 2 nurses. That's for basic life support. So, and our intention was to start with the basic life support. But now that we don't have paramedics, and also the number of nurses that we have available in the system, if you draw them from the secondary facilities, there will be a problem. So, and we have a lot of community health extension workers that are not employed. So what if we use them and train them specifically for this? So that is how it was done. Then the next is to ensure that their physiological state is okay. And this was done by basic examinations and some tests, which included the toxicology test. And that time we ensure that once toxicology is done and you are found to have a trace of any of those substances that are abused, you are disqualified.
After extensive deliberation, the committee was taken around to the administrative offices, a 24-hour call center, and ended up their tour with a courtesy visit to the Yobe State Commissioner of Health's office, where he applauded the effort of the State Commissioner of Health, Professor Baba Malamgana, for establishing the State Emergency Ambulance Service Committee, which he said is very crucial in saving lives of our citizens.
first of all, I would like to welcome our elder brothers, Borno State, to Yobe State on this very important learning tour. Both states share commonalities, and the establishment of emergency medical ambulance systems is actually very critical, because this is something that is needed, not only that as we see even in advanced societies and even in societies that are less advanced as we are. A lot of emergencies happen, away from hospitals, on the roads, probably during when accidents happen, or even at home. There are certain emergencies, maybe in the dead of the night and so on and so forth. So that quick response and transportation to the health facility where services and responses are going to be provided, or interventions are going to be provided, is actually very important. So as such, my advice first is to congratulate Borno State for going that route, and my advice is that this needs to be taken very seriously, and we also hope that with this learning, we've followed so many routes before we actually established ours. We went on learning tour ourselves to Lagos, and then we collaborated very closely with the national, just as I've narrated. So the system that we've tried to establish is a direct mirror of the national, as well as, of course, where we have also learned. I advise that similar is also done by Borno.
The Director of Operation of Yemo Bus, Dr. Said Garba, and that of Ambulance Services, Dr. Estefanus, have some advice to Bosemsas.
But for our colleagues in Borno State, it is really an agency or a program that needs to be supported. Why? Because emergency happens to anybody, irrespective of your status, as a politician, as an administrator, whoever you are, as a rich, as a poor, anywhere it can happen. So when you have understood the fact that we are all living, we are all human beings, all of us can be a victim of emergencies, supporting such programs has a way of touching lives. Even that person that you least expect he will benefit from this, he will enjoy the services, especially for the first 48 hours where you save life, and it will go a long way. So it's also a way of cajoling or speaking to our community, because when you say it and they see the response coming from that community, they will see the impact and lives are being saved. And that's the reason why they are there.
I'm optimistic because I've seen the passion, I've seen the interest, and it all starts from there. And I've seen from the caliber of people, I see people that are capable, and I believe something will come. The benefits are so much that sometimes you cannot even mention all. But the most important thing is for Borno people to know that with an efficient emergency medical service, an ambulance system, the population, like the people in the community, will benefit by prompt access to emergency care. And not just that, the fact that the first 48 hours is covered for. Emergency happens when you are least prepared most of the time. So if you have someone somewhere that can take care of all those things at their time of need, I think it's something that we cannot overstate. So I think Borno people will benefit from this.
Well, viewers, we have come to the end of this episode of Borno Health Update. We hope you enjoy the program. Join us next week for another interesting segment. Until then, I am Ibrahim Amarawa saying bye for now.